These are the things that smart nursing students do that absolutely kill your grades in nursing school. And no, like I said, it's not because you're not smart enough. Lots of smart nursing students do these same mistakes that I'm going to tell you about today. And it's not because you're not trying hard enough either. I'm Nurse Nicole. I'm the founder of Your Nursing Tutor, and I've spent 15 years helping adult learner nursing students just like you get comfortably passing grades, learn to think like a nurse, and to do it all while still living your life in nursing school. Mistake number one is trying to memorize everything. I was just having a conversation last night with one of my students in my Study Like a Nurse tutoring community because we had a group tutoring session where people could ask me questions in real time, and I'm helping them personally with their questions and the things they're studying and struggling with in nursing school. And we were pointing out that when it feels like there's so much to study, the temptation is just to know it all. And you get told this by your instructor. You get told you're responsible for everything in the textbook. Tell me in the comments, have you been told that before by an instructor? Because I want everybody to see that that's kind of gaslighting. Because do you know how many people it took to write that textbook? And you're only one person. So, yeah, I don't think they expect a beginning nurse to actually literally know everything in the textbook when it takes that many people to write it. And those are all expert nurses. So let's put that to the side. But you will be told this by your instructors anyway. And so we need to uh, understand that that's going to give you the temptation to feel like you have to memorize everything. And that could not be further from the truth. You are not actually being tested in nursing school on what you memorized. So let that sink in because you're probably thinking right now, Nicole, you're wrong. Obviously, I need to know, I need to have this stuff memorized. But that's not the case. That's not the case. Because you could literally, if you had like a photographic memory, you could literally memorize every word in that textbook and still not be able to answer the questions on your test. Just think about it. Think about one of the recent test questions on a nursing exam that you struggled with. It probably asked you a scenario and it gave you, some information about a patient, perhaps, and then it asked you which of the following is the priority nursing action in this case. Now, you are not going to look in your textbook and be able to memorize and be like, in this scenario, you are going to do this first, okay? Because the answer to how you choose that is always it depends. And that's because they're not testing you on what you have memorized or what you know. They're actually testing you on how to think about what you know. This is what they really mean when they keep telling you that you need to improve your clinical judgment. You need to improve your critical thinking. You need to learn to think like a nurse. Okay. All that stuff, all that abstract stuff really means is that they're testing you on how you think about the nursing content. Now, this implies that there is some stuff to memorize. Okay. There's some stuff to memorize, but not all of it. Okay. And I actually have some videos on how to memorize in nursing school, which I'll tell you about in a second. So hang on, and I'll give you that information near the end. But so instead of trying to memorize everything in nursing school, you need to focus first on understanding the right, I'm sorry, memorizing the right kinds of things, and then understanding the rest, thinking about the rest, because that's what you're being tested on, right? So, what we want to do, the first thing that you do need to memorize is the part that gets skipped by almost everybody. It's how to think about normal. It is what is normal. So, instead of focusing on trying to memorize like all of the signs and symptoms and complications and side effects and nursing care, we want to start with memorizing normal. Now, you know, perfect NCLEX world, we would still remember that from our anatomy and physiology prerequisites. But this is not perfect NCLEX world, is it? This is the real world. And I work with a ton of adult learners. They have families, they have jobs. It may have been a few years since you've taken anatomy and physiology. That's okay. I actually have lots of good strategies for how to refresh your anatomy and physiology in a not overwhelming way. I do that using my Silver Bullet study system. And the first step of my Silver Bullet study system, we ask ourselves this very simple, basic question. And this is the stuff that is most important to memorize. And the question we ask is based on what do I need to know about normal? What do I need to know about normal before I can understand this topic I want to study? So whatever topic is you're studying and preparing for your next exam, you ask, what do I need to know about normal to understand this? And right away, you're setting yourself for a good foundation. Because as I was telling this tutoring student that I worked with last night, if we memorize this little box of what's normal, okay, that's a defined subset, right? There's only so many ways things can be normal, right? Uh, And then when we get to the test, anything that is not inside that box, we just know that even if we didn't study it, we know that's going to be abnormal. And then we can be like, we can kind of identify it. It helps us to start identifying abnormal stuff that we will need to take nursing actions for, uh, on tests and in real life scenarios. So that starts with memorizing normal. That's the number one thing you do still need to memorize. And then symptoms, complications, nursing care, you start to just understand that when you follow a good study system, study process like the Silver Bullet study system, but it all starts with what's normal. Mistake number two that is killing your grades is treating all content like it's equally important. It is not. This is the reason why I always tell students I'm known as the tutor, the nursing tutor who tells you to do less. I'm the nursing tutor that tells you not to read your textbook. It's not because I hate textbooks. I actually have a whole pile of textbooks that I use regularly. But the difference is I do not read them like it's Pride and Prejudice. I don't read it like it's a Jane Austen novel, okay? Textbooks are meant to be read like a dictionary, not a novel. And the way we read a dictionary is we open it up, we say, we have a question in our mind, like, how do I spell this word? We look it up, we figure out how to spell the word, we get our answer, and we close the textbook and we move on, or close the dictionary and move on with our day, right? So when we are studying, not all content is created equal. We don't need to know the word, how to spell the word above it or the word below it. Now, the challenge is when you're studying in nursing school, how do you know what's most important, right? This is the one of the core problems that nursing students tend to have is they want to know how to identify the most important information. And the bad advice that you often get is, oh, you just have to think like a nurse. I think we all know the problem with that advice, and that is you are in nursing school to learn how to think like a nurse. So if you're in nursing school to learn how to think like a nurse, how can you think like a nurse in order to identify the most important information that then helps you learn to think like a nurse? So you see the problem here. So instead, we just have to go back to this question-based format of studying, which is what I teach with the Silver Bullet study system. And you start with that question number one that I told you about the memorization mistake, which is what do I need to know about normal before I can begin to understand this topic that I'm trying to study. And then from there, we just ask more questions. You know, in nursing school, the better you get at asking the right questions, the better you get at learning to think like a nurse. Okay? Because you might not know the most important information, but you can learn how to ask the right questions. And once you learn and get really good at asking the right questions, gosh, it's so easy to get questions answered nowadays. We've got Google, we've got YouTube, we've got our textbooks. You've got me if you're in my nurse study like a nurse tutoring community, okay? You can answer questions if you have the right question to answer. So, isn't it a better use of your time to learn how to ask the right questions? Even if you're using AI, a lot of nursing students nowadays are using ChatGPT, and you're just dumping your notes or the PowerPoint slides into ChatGPT and asking for a study guide, and you're still struggling in nursing school. It's because even AI is not brilliant enough to ask, you still have to ask AI the right questions in order to get the answers that are going to help you learn to think like a nurse. Okay. So, and if you're interested in how to ask the right questions, I'm going to drop the link in the notes, but make sure you go. I have a free video for you on the Silver Bullet study system that I teach. It's just go to the website. It's yournursingtutor.com/help. Okay. And it's just a free 10-minute video that gives you a whole overview that'll get you started on asking the right questions. The third big mistake that smart nursing students are doing that kill your nursing grades is studying passively instead of actively. Now, I think it is an absolute crime that this is not discussed in your nursing school orientations. Okay. The other crime I think is about Bloom's taxonomy, but that's a whole nother video. Let me know in the comments if you want me to talk about that sometime. But there's passive learning strategies and there's active learning strategies. And there's a ton of research out there that shows that we retain more when we use active learning strategies than passive learning strategies. And it's not even close. We retain significantly more. So if you've ever sat back and thought, oh, I just have an old brain, I'm not as good at memorizing as I used to be, that's probably not entirely the case. Okay. What it probably is that you are trying to memorize these higher level concepts, learning how to think using passive learning strategies, and it doesn't work. So, what are passive learning strategies? It's all the common study strategies. Like, I'm going to tell you this list, and you're going to be like, oh, that's everything I do. Don't feel bad. That's all we all start out with. We've basically been trained to study that way in our Western education system. Okay. It's going to be, I call it the couch potatoes of studying. Okay. It's just reading the textbook without any questions in your mind. It's copying our notes. So I took the notes, now I'm just recopying them. It's listening to lecture, but not engaging. It's just listening, right? It's listening to lecture repeatedly. It's highlighting in our textbook. It's watching YouTube videos, all these things. So I call it the couch potato of studying because it always feels like we are doing a lot when we study using passive learning strategies. And if you're like me and you're like a checklist girl, you just love checking things off your list, passive learning strategies like feed that. Okay. You feel like you've gotten so much done. You're like, oh, I did 100 NCLEX practice questions today. I am so accomplished. And then you fail your exam because it was still passive learning. Even though you checked off a lot, it took a lot of time. You are not lazy. Like you are putting in the effort, but the type of effort you're putting in is not the kind that gets you the results you want. And it's kind of like sitting on the couch and just binge watching a Netflix documentary all day. Okay. Like if you watch a documentary about surgery, are you prepared to go in there and do the surgery? I hope not. I hope nobody's letting you do that, right? You have to actually get in there and get training and try it for yourself and be actively doing the surgeries in order to be able to get competent to do it on your own. Okay. Another example I use for active learning strategy then is it's kind of like if we want to get healthy and get fit, we can watch a documentary about working out and exercise, but that doesn't make us stronger. But we feel accomplished. We think we learned a lot of stuff. We feel like we learned a lot of stuff. But the reality is, we're not going to actually see any progress until we get our butt off the couch, quit with the passive learning strategies, go to the gym, and start doing some bicep curls. Okay. And here's the scary thing though, that when students do this without any sort of mentorship or encouragement or guidance, they're just like, okay, Nicole said I need to do active learning strategies. I'm going to go to the gym and do my active learning strategies. Uh, they are more likely to quit if they're doing it on their own than if they're doing it with professional guidance. And the reason is the same reason why people quit going to the gym without profession when they are doing it on their own. It's because if you go to the gym one day and you work out, by the end of the day, my bicep is not going to be any stronger, but it is going to hurt a lot. Okay. And so you don't see those immediate, quick results that we would love to have, but we all know realistically, you're not going to learn to think like a nurse overnight. Okay. It takes time and practice to develop that skill, but you should be getting a little bit better bit by bit over time, right? That's understandable. And it's the same thing with working out. We're working out our brain with learning to think like a nurse is like working out our muscles. So what we have to do, just because, our bicep hurts and we're not stronger after one day of working out, doesn't mean that working out doesn't work. It just means we have to keep doing it consistently over time. We need to keep doing the right kind of training consistently over time. And again, silver bullet study system helps with that. But any kind of active learning strategies really is what you need, and you need to replace your passive learning strategies with that. And by doing so, you are going to see amazing results. But it's can be a little bit scary to do because, like I said, those reasons I just said about going to the gym and why people quit, but also because active learning strategies, like an individual active learning strategy, sometimes usually takes a little bit longer than just sitting back and watching a documentary or a quick YouTube video or flipping through your textbook. Okay. It hurts your brain a little bit because it's engaging it. And it does not usually let you check as many things off your to do list. So it might feel like then you're not doing as much when you do active learning strategies. But the trick is that the thing that you are doing is so much more effective that there's really no other way to do it. So if you want some help, uh, you know, transitioning from passive learning strategies to active learning strategies, this is kind of, it goes along with the memorization thing, right? Like memorization, the first mistake that I talked about is really about, um, you know, passive learning strategies. A lot of memorization happens because we're doing, or tries to happen. We know how that kind of floats away after the test, but the memorization tries to happen because we're using passive learning strategies and we're used to doing it that way. So when we transition from passive learning strategies to active learning strategies, we also need to look at memorization a different way. So I have a video that you should watch, which is called, ironically, How to Memorize Everything in Nursing School. Spoiler alert, you won't be memorizing everything, but I'm going to show you the things that you should be memorizing in a little bit more detail and the strategies you can use for something else. And so make sure you watch that video next.